Hi, everyone. Thank you for joining us today. I'm trying out a new pair of headphones. I'm hoping that you guys could put in the chat. Can everyone hear me? Oh, fantastic. Thank you so much. First time I tried connecting my headphones to this, so I'm excited to see that it works. All right, well, thank you so much for joining us for our class today on blockchain healthcare. So my name is Clay Carrington. I'm the Executive Director for the Canadian Blockchain Consortium. And today's class, we're going to be discussing just how blockchain technology can play an essential role going forward in building the healthcare system of our future. So I'm really excited to share with you some of the ways that this emerging technology can help to overcome some of the most critical issues that are currently facing our healthcare sector today during the COVID-19 crisis, but also beyond. So I always love to talk a little bit about the background for CBC, for those of you who are new to joining us. So a little background, we're Canada's national organization for education, for awareness and advocacy for blockchain technology. We love engaging, we engage with public, we engage with industry to discuss how this incredible technology is going to be able to help build our digital future. And we're so grateful that we, as a not-for-profit organization, have the support of so many incredible members, like you're seeing on the screen right now, from Royal Bank and MMP and some major law firms. So we're very grateful to have a lot of industry support with what we're doing. We also absolutely love engaging with our public. So we'll definitely have a Q&A after this. So type your questions, any questions that you have in the Q&A. I'll do my best to answer them, as I am not a healthcare professional. I'm going to do my best to answer based on what I understand about the technology, but please ask any questions. And if I can't answer them on this, I'll go find the answer and email them to you. Also, we'd love it if you guys would follow us. We're on Twitter, we're on LinkedIn, we're on Facebook. If there's anything that you like from the class today and you want to shout it out, please do so. We'll love to like it and reshare. So a little bit about the topics that we're going to be covering for this class today. And this is, I think, our second class. We're going to be doing a series of these classes. Probably every single month we'll have a different class coming out. I think next month we have one on economics. The following month after that, we have one on like this, what is blockchain in general. We also have one that's coming out on how to identify scams in the cryptocurrency space. So that'll be a good one coming out soon. But the topics for today is talking about like unprecedented disruption. We're going to be talking about technological trust. We're going to be talking about stronger supply chains, secure digital identity, healthcare and cybersecurity, and then we'll get into the Q&A. So our first topic is truly this unprecedented disruption the pandemic has caused to our healthcare system, and why it might be a catalyst for long-needed digital transformation. So this is a really great quote from Gartner. So when traditional channels and operations are impacted by the outbreak, the value of digital channels, products, and operations become immediately obvious. So it's a really great quote. And I've seen over and over again my experience just in the last year that digital technology adoption, including for blockchains, has become obviously a key solution for any challenges the future might bring. Change comes under great pressure, and right now we're seeing on a global scale there's definitely a lot of pressure, and our healthcare system is definitely feeling the impact of very slow technology adoption. Times of disruption are also catalysts for really incredible innovation, and the COVID-19 pandemic has definitely created some massive movements towards a digital adoption across both private and public sectors. Really fascinating. So McKinsey Institute did a interesting bit of research saying that in the first 4 weeks of the pandemic, digital adoption across businesses actually leapt forward by 5 years. And I'm sure you guys are seeing it in almost like every aspect of your life. Like, you no longer even need to go into your bank. You can, take a photo, deposit your check. You can have virtual conversations with your banker. You can virtually meet with your doctor. There's so many different ways that everyone's been innovating, and it's because based on some of the restrictions in the pandemic, there hasn't really been a choice but to innovate and try and move forward with these things. So yeah, 5 years of technology adoption. There's some aspects of it I really enjoy, some that are slightly a little more frustrating. But it's definitely put in the healthcare sector, increased pressure on supply chains. There have been some pretty incredible high profile security, cybersecurity breaches, and definitely a very urgent need to establish proof of provenance for medical supplies, because the last thing you want is to get some, PPE or vaccinations, medication, different things like that without being able to know exactly, where the origins of that are coming from. Has there been a disruption in the supply chain? Is it actually what you thought you were getting your hands on? So that part's very, very important. And these challenges are definitely going to continue into the future. So maybe in some unexpected ways as well. So all of the world's major health organizations have been warning for years that increased global travel is likely to cause more disease outbreaks in the future. And the coronavirus pandemic, I don't really see it as being like the start of an era where public health would be a primary concern. I feel like we've had definitely things in the past. This is a new level of response, but we had SARS, we had MERS, like the coronavirus in and of itself. There have been many different strains of influenza. This is probably one of the most first kind of globally recognized ones that's definitely disrupted our world. But all of our systems, from supply chain to identity management, are going to need a pretty major digital upgrade if we're going to be able to kind of manage and navigate the future threats in a way that allows for, businesses to stay open and for people to still be able to, not overburden the healthcare system, make sure that they're confident in their food supply chains. I think we all remember the runs on toilet paper that hit at one point. So as we recover from the urgent part of the crisis, the same technologies we adopt will kind of form this foundation for a better and more digitized healthcare system moving forward. So according to Deloitte, as the world moves towards this like post-pandemic recovery, there will be major transformations that shape a more optimized and crisis-resilient future. And they're saying that blockchain technology kind of fundamentally, reshapes the way healthcare functions by building a new ecosystem that puts a central focus on the individual. And that's a model that provides better healthcare, better data privacy, better patient empowerment over the course of the treatment. And later in, I'll get into a couple different case studies for companies who are developing out apps that help with being able to have kind of like that self-ownership of your digital healthcare identity on blockchain and things like that. So definitely interesting innovations are happening in this space. So one of the very key benefits of blockchain technology is what's called technological trust. But what it truly does is it actually removes the need for trust from the actual equation. So in this section, we're going to explore a bit more about how the technology behind blockchain actually removes the friction from systems and organizations by ensuring that all parties are working from the same set of verified but also immutable facts. Because I'm sure all of you experienced, if you've gone to your doctor's office or your chiropractor's office or your naturopath or any of the different practitioners, every single time you're probably filling in a paper form. Most likely they're still done on paper, and they're not all operating off the same system. They're not all able to see the everything that you filled out on the form. Your chiropractor's not sharing that information with your doctor, which isn't sharing it with your healthcare professional. So there could be important bits of data that are being actually missed because of that, or taking it from paper and somebody putting it into the computer and digitizing it. There could also be misinformation that gets just that transfer right there. So being able to do this completely digitally and having ownership of that data and then choosing who you share it with, I think is going to be an interesting piece that comes out of this. So blockchains are often considered kind of like complex as well as confusing, but essentially the elements are actually pretty simple. A blockchain is just an immutable time-stamped series of pieces of data that they call blocks that are managed by a cluster of computers that are considered decentralized. In some cases, some actually may be centralized, but generally speaking, they talk about decentralized. And each of these blocks of data are secured and bound to each other using cryptography. I won't get into the highly technical aspects of that part of it in this class, but it is incredibly secure using things like SHA-256. So in industries like healthcare, the networks that host these systems are permissioned. So only authorized parties can actually see and share the data. So even though it's decentralized, unlike things like Bitcoin's blockchain, where you can see every transaction that's ever happened in the healthcare system, would be privatized, so they wouldn't be able to, no one would be able to see or access your data unless permission was actually given to them. So, because there's a lot of privacy around this. So here are just some of the ways that blockchain networks actually create a trusted system for managing data. So first off, transparency. So all users on the blockchain network that have the access can see the same set of facts. And this is very helpful for reducing friction and disputes and errors. So if you're thinking of it from a supply chain perspective, right? Right now in traditional supply chains, you probably have like various different parties. Let's just pretend there's like 20 different parties along that supply chain that are not sharing data with each other, that are getting items and having to push them up forward the whole way through the supply chain. If you had if they're all sharing a particular set of data facts on that blockchain, you'd be able to see exactly where it's sitting at any given point. Everyone has access to the exact same amount of data. If anything changed, you'd know when the change occurred, maybe not exactly what the change is, but at least you'd be able to identify things like that. So distributed, where all permissioned users on the blockchain network have access to that same information. So allowing for instant sharing of critical information. So if there's any kind of disruption at any point in the supply chain, you'd be able to share that information instantaneously across all parties, so they'd be able to know. Encrypted. So each piece of data that enters the blockchain network is secured by a virtually unbreakable cryptography that can only be decoded by authorized parties through a digital key. So if you're not really familiar with cryptography, one of the ways to look at it is like encryption. So an example of encryption, some of the earliest signs of it were actually found in about 1900 BC in an Egyptian pharaoh's tomb, which is pretty interesting. And then fast forward, if you're looking at, if you've ever seen any of those movies that were kind of like historical timepieces, probably 1800s when they were in war times, they would have a letter and they would like deliver that letter to some general, and it would just look like a really basic letter, like, oh, the kids are doing this, that, and the other thing. But they would actually have like a cipher, and they'd be able to decode whatever that special message was inside that letter. And if you didn't have that cipher, if you didn't have that decoder, you wouldn't be able to read what really is the full intention of that letter. And that is a very kind of like basic rudimentary form of it. Fast forward to today, now that it's digitized, you have a very, very secure network where you'd be trying to force solve a very complex functional equation, and you'd have to go through billions and billions of different equations to try and figure exactly what the right one is. So it'd take a very long time, a lot of computing power to try and break into cryptography. So very, very secure, and then immutable. So the data on the network can only be read or added to. It can never be deleted. So you can see any single change that happens. A good instance of that is like if anyone uses Google Sheets for their business, it's another form of like distributed ledger database. You can see any single person that made the changes, what they changed, when they made those changes, almost like a, if you're used to Word documents tracking changes. But in this sense, you can't delete any of the tracking changes. You can't hide any of that. So it prevents fraud and creates a foundation for a lot more shared trust in the space. So while there's definitely a lot of advantages to using blockchain technology in sectors like healthcare, I would consider these three kind of like overarching benefits really, really solid. So one, authentication, just having that, providing traceable, instant proof of provenance for authenticating things like PPE, for vaccinations, other supplies. Very, very critical. And again, data security, being able to prevent dangerous data breaches of private patient information through advanced cryptography. And a lot of places have been getting those, what do you call it? They're hacking, they're trying to take the data and they're saying, oh, we'll release your data if you give us Bitcoin, things like that. If they had higher levels of data security, they'd have less of those breaches, which would be really good because you don't want your information being shared with people that you don't want to have it. And then health credentials. So enabling verified and transferable smartphone health credentials like proof of vaccines. I know we've heard, maybe not all of us have heard, but they're talking about having a like a health passport. So if you want to travel or do certain things and be able to show proof of the vaccination, of course they want that done in a way that's rather immutable, so you couldn't just add data or false data into the system, so they know exactly who's been vaccinated, who hasn't, as those kind of things. It's starting to come down the pipe where they're looking at using blockchain technology for it. So interestingly enough, so Canada is sometimes considered a slow adopter of emerging technologies. I know a few years ago, looking into statistics, we were behind like Europe, Asia, United States in terms of digital technology usage, let alone even adoption. But interesting, blockchains are actually growing quickly in our industries and quite especially in healthcare. So at nearly 70% compounded annual growth rate is expected over the next 5 years. We're actually set to become a leader in the blockchain for healthcare market, which is expected to hit about 1.6 billion US by 2025. So only 4 years away. That's quite a fair bit of money to be made in the space if you're dealing with blockchain in healthcare. So our next learning segment, we're going to be focusing on the issue that has come pretty front and center during the pandemic, and that's the health of our healthcare supply chain. So this is from, again, your PPE, vaccinations. Major concerns about fraud have come up, and the industry has faced some pretty massive challenges that ensuring that essential supplies are delivered on time and where they're needed most. I know some where Canada's very low on the poll in terms of being able to like roll out and deliver the vaccines. And one of the issues that we had with it was in the contracts, they didn't have a date and time. It was just paid upon delivery in some of it. So there wasn't like a timeline or incentivization for these companies to roll out the vaccines to Canada before others, because we had no particular timelines that were put on those contracts, which did kind of suck. But having this kind of stuff on blockchain, being able to see where we're at in the process and being able to deliver proper timelines to the populace would be very, very helpful in instances like this. So here's 3 of the largest challenges that are currently facing our global healthcare supply chain. So one would be supply chain fraud. So because blockchain technology can provide this unalterable proof of provenance that ensures that medications and other important supplies are legally obtained and free of counterfeits, that will be a really good one. Another one, distribution delays. So having automatic GPS enabled and instantaneous monitoring of supply chains will definitely mean less delays, but also better awareness, faster pivots for essential supplies to places where we need it most, right? So like senior care facilities, things like that. And then also infrastructure costs. So if you're optimizing your supply chains by using a technology like blockchain, organizations can actually dramatically reduce like expensive errors, redundancies, and labor-intensive paper-based process. So I know, especially in the hospital systems, it's still very much handwritten, and then you hand it to an intake nurse, and then they digitally put into the system. That is a lot of redundancy in things that are happening there. I know even governments that are looking at adopting it. I think Saudi Arabia was looking at shaving off almost like $400 million in cost by going paperless and using blockchain as opposed to doing their traditional system. So lots of cost savings to be had by upgrading your database, that's for sure. Even if it's not specifically a blockchain, updating your database can definitely create some really good efficiencies. So of course, just overcoming a lot of these really huge hurdles, it's going to require an incredible amount of cooperation between members of the healthcare industry. And even though these groups have been kind of more like natural competitors, which is why things like consortiums are really great, because it gives that neutral ground for companies to kind of come together and share ideas. So MediLedger is actually a consortium that was created to find ways to build this global supply chain network on blockchain specifically. And it's got participation from incredible industry giants like Pfizer, like Mickelson, and what's the name of the other one? Amber Source Berger. I probably butchered that name horribly, I apologize. But the new US law on drug supply chain and security means that this technology is more essential than ever for ensuring that drug provenance and prevention of theft, especially for Class A drugs like opioids. And we've been hearing about a lot of the overdoses that have been happening right now during the pandemic. So being able to withhold medication like that, unless it's people who actually need that medication, would probably help with that a little bit at least. So another issue, in healthcare that is becoming more prominent during the pandemic is how we're managing our patient identity as well as our records. And blockchain technology, a lot of people have been hearing like digital identity as a big one coming out, but it's a key way that the industry is moving towards a greater digitization. So this to me is very, very important because we're going to be seeing later on that the healthcare sector is facing some really unprecedented security threats. So the core idea behind blockchain applications for that digital identity management, or the digital me, so to speak, an accurate online representation of an individual that can include identity, biometrics, other healthcare data. It's like it's kind of like having an online avatar, and that provides a complete picture of who we are. And in the future, it's predicted that we'll be able to access our healthcare services to be provided better care by being able to use this digital me. So these are the different kind of roles that make this up. So one would be the issuer. So you have issuers that would be like institutions like government agencies, banks that issue an encrypted credential to other users that's authenticated on the blockchain network. And then you'll have your verifiers. So verifiers will be like your hospitals, your clinics, other institutions that can automatically verify a patient's identity through scanning their digital credentials. And then of course you have how you're going to interface with it, which would be an app, which is a secure, very likely phone-based wallet that will host your digital credential representing your identity, but also protecting you through advanced encryption. So next slide, sorry. So interesting enough, so IBM Watson Health, they're combining blockchain technology and artificial intelligence to create a health passport for COVID-19 test results, your vaccination status, declarations, and other proof of health certifications. And we're seeing the signs that this could become a big part of activities like traveling. From what I've seen so far, I think they're still kind of in that early stage of development with this one. It's not quite ready for mass rollout yet. Although just the simple idea of vaccination or COVID test credentials definitely brings up privacy concerns. But IBM says that their blockchain mobile app is designed to strongly protect this very sensitive healthcare data. So let's talk a little bit about healthcare and cybersecurity. So protecting patient data is becoming a lot harder because the healthcare industry is experiencing such an incredible wave of cybersecurity attacks, unlike anything that they've actually experienced before. And these threats are expected to grow very quickly over the next few years. So our next section, we're going to look at how blockchain technology can become a game changer for this cybersecurity. So This statistic I personally find absolutely shocking. So in 2021, the industry is expected to experience 3 times the cybersecurity incidents it did just in 2020. That's a massive growth rate. So globally, healthcare is the single most targeted industry for cybersecurity incidents like phishing schemes, database breaches, network attacks, and it's a really dramatic rise in these threats that have happened, during the COVID-19 pandemic. And it's just definitely creating this urgent push for better security through blockchain technologies. Areas of very critical concern are identity theft, data breaches, and the very high cost of each data breach. I think they were saying that it's like over $7 million per breach, depending, and that may or may not be depending how much they're actually charging you to gain access to your data again. These are some of the pretty awesome companies that are working to make the healthcare industry safer. I got to meet BurstIQ. It's definitely a very interesting company. They're doing things globally right now. They're an American company. I think they're based out of Colorado, and they are using kind of like big data, blockchain, artificial intelligence to manage patient records. So this company focuses on 3 key benefits. So better cybersecurity through advanced encryption. They use data intelligence by combining digital technologies and streamlining compliance with healthcare regulations like HIPAA. So BurstIQ says that their combination of emerging data systems can even help identify prescription fraud for opioid abuse, which are 2 very big issues that are currently impacting our healthcare sector. So just thank you so much for joining me today. I know they're quicker classes. It's not as long as when we do our webinars. We hope you join us for those as well. We do have some great stuff coming up. Again, like I said, the different classes, we'll be doing those every single month. We have some interesting interviews with some awesome people coming up in the space. And then we also, of course, have our webinars, and we also recently launched a magazine. So if any of you guys are interested in learning all about what's happening in the space in a quick 30-minute read, we'd love it if you join us for that. So if you guys have any questions, I'd love to get into the Q&A, and if not, I will give you a bit more of your day back. Awesome. Well, I'm so glad you guys joined us today. Thank you so much. Our next one coming up is blockchain and economics. So we're going to be discussing the use case for blockchains, the economics behind it, the difference between Austrian and Keynesian economics, and why Bitcoin seems to be having this huge economic use case. So thank you so much for joining us today. Check us out on canadablockchain.ca, and I will see you next time.